Community Psychiatry for the Center for Global Mental Health and Center for Implementation. He's best known for his work on community mental health services, stigma and discrimination, and global mental health. He's published 30 books, which is amazing, and has written over 500 peer-reviewed scientific papers. Thornicroft was made a Knight Bachelor in 2017 for the Queen's Birthday Honors for service in mental health. He really is a global leader in the space, as you will see from his work with fundamental SDG and the Sustainable Development Goals, and he's a real hero of mine. And then Nicole Votruba is a researcher at the Institute of Psychiatry, Psychology, and Neuroscience at King's College London, focusing on global mental health, stigma and suicide prevention, and research impact on policy. She co-leads the Indigo local project on stigma interventions through media campaigns in low and middle income countries. Nicole is coordinator of Fundamental SDG, a global initiative to strengthen mental health in the UN Sustainable Development Goals. She is currently also doing a part-time PhD aiming at improving evidence policy relationships for mental health. And again, they are both doing extraordinary work in mental health, and I've been so fortunate to have worked with them, and I'm excited for them to talk today about how mental health relates to the Sustainable Development Goals. I know there's been so much focus with what the UN is doing with the Sustainable Development Goals and why mental health is an integral part of that, and just share more on their work. So thank you so much for being here.
Hi, Catherine.
Good to see you.
Thank you very much. My name is Nicole Votruba.
Hello, everybody. My name is Graham Thornicroft, and the first part of the talk Nicole will give, and then I'll come in and give the second part of the talk a little bit later. Nicole.
Thank you, Graham.
Perfect.
Hi. Okay, so Graham and I will tell you today about the place that mental health has in the United Nations Sustainable Development Goals. And to do that, we'd like to first briefly set the scene on why mental disorders are relevant when we talk about the global development context. And we'd like to give you 3 reasons for that. So 1, mental disorders are a leading cause of disability worldwide. 1 in 4 people has a mental disorder in the course of their life, and 600 million people are currently affected. And mental disorders are also a leading cause of mortality and early death. So suicide in young people, young men particularly, between 15 and 29-year-old, is the 2nd leading cause of death. And women with mental disorders on average die 10 years earlier, and men with a mental disorder die 15 years earlier than people who don't have a mental disorder. So what we can see is that mental disorders are killer diseases. And the numbers that I've just given you are numbers for high-income countries. So coming to the 3rd reason is that the situation is much worse when we look at low and middle-income countries, because there's an excessive treatment gap. And that means that there's a much higher number of people who have a mental disorder who are not being treated compared to those who are being treated. So overall, globally, there's roughly 2/3 of people with a mental disorder don't receive treatment. And when we look at low-income countries, over 90% of people with severe mental disorders don't receive any treatment. And that is the situation is aggravated by stigma and discrimination and human rights violations towards these people. So what has the United Nations done in relation to mental health? Well, they have acknowledged mental health. Already in the Constitution of the World Health Organization in 1946, and they say that health is a state of complete physical, mental, and social well-being. But it took over 50 years until mental health really found a place in the global development setting. So when we look at the first generation of development goals, that was in 2000 to 2015, they were called Millennium Development Goals. And these development goals were focusing on several health areas, but none of them looked at mental health. And when it came to the next generation of development goals, the 2015 Sustainable Development Goals, and the years leading up to that, it became clear that mental health was once again at risk of being ignored and not being acknowledged within these global development goals. And so Graham Thornicroft, together with other global advocates for mental health, thought, okay, this is unacceptable, this cannot be done. And Graham, together with Professor Patel, issued a call to the United Nations to include mental health among the new Sustainable Development Goals. And Graham took initiative and founded a global initiative, grassroots initiative, Fundamental SDG, to strengthen mental health within the Sustainable Development Goals, targets, and indicators. And so together I'm coordinator of Fundamental SDG. So together we advocated, and with a steering group of global leaders in global mental health, we advocated at the United Nations and organizations, and we got support of many international organizations that some of them you can see here, and many hundred individuals that supported our cause. And one of them is a photographer called Robin Hammond, and he's made a beautiful video to support our cause that's been shown at the United Nations and in many places around the world to support the work of Fundamental SDG and the cause of including global mental health in the SDGs. And we'd like to show you this video briefly, if it works. So we've been advocating with Fundamental SDG to strengthen mental health and to get it included in the SDGs. And there were also other global leaders who then started speaking out for mental health. For instance, Kofi Annan in 2014 said that the United Nations need to place mental health in general and depression in particular within the United Nations Sustainable Development Goals. And so in 2015 in September, the Sustainable Development Goals were adopted by the United Nations. So what are these development goals? Well, they are a call to action by the United Nations, and they are supposed to be implemented within over 170 states and territories worldwide. And most importantly, they guide the United Nations funding and development policy and funding for the next 15 years, so up to 2030. And the Sustainable Development Goals are composed of 17 goals. They range from health to poverty to climate action, different areas of development. And these 17 goals are broken down into 169 targets to make it more feasible and to make it really measurable what is being done and achievable. There are 230 indicators linked to these goals and targets. So when we look at mental health, where it is within the Sustainable Development Goals, we find it already in the preamble. So the United Nations have stressed that it is important to promote physical and mental health, and that we need to achieve universal health coverage, which includes. And they also stress in the preamble that the United Nations are committed to the prevention and treatment of NCDs, so non-communicable diseases, including behavioral, developmental, and neurological disorders. And when we look at mental health, in particular, the goal 3, the health goal, the goal for good health and well-being, is relevant amongst all the others. And there are 3 targets that relate in particular to mental health. So there's one target on the prevention, treatment, and promotion of mental health. And there's an indicator linked to it to reduce suicide mortality rate. There's another target on substance abuse. So there's one to increase coverage of treatment for people and interventions with substance use disorders. And there's an indicator to reduce the harmful use of alcohol. And then there's a target on universal health coverage. So one indicator to increase coverage of essential health services, and one indicator to measure the number of people and to increase the number of people who are covered by health insurance and public health system. One thing that has been missed out this time in the development goals, and that remains a future priority, is to take specific consideration of people with a severe mental disorder who are using services and to increase the focus for them. This is something that Fundamental SDG, together with others, has been advocating for, and hopefully it will be included in the next round. But when we look at mental health, it's not only relevant to look at the health goal, but really mental health cross-cuts the SDGs, because all the SDGs are in a way linked together and depend on the achievement of each other. And we can see that mental health relates to most of the 17 SDGs. And there's very good work that has been done by colleagues Crick Lund, Vikram Patel, Graham Thornicroft, and others in the so-called Lancet Commission. And they've developed a framework where they have mapped social determinants of global mental health and the SDGs. So social determinants are the social conditions that we have that influence mental health, and mental health is highly influenced by those socioeconomic conditions. And we need to look at improving and changing the socioeconomic conditions that people are in order to have substantial and sustainable improvements in mental health, not just to improve treatment. So when we look at these social determinants, they have mapped them out in 5 different areas. One area is the socio-demographic area, and there in particular we find, for instance, gender equality. So where does mental health come into play there? Well, when we look at women, for instance, there's an increased risk of depression and anxiety in women, and in men, by comparison, is an increased risk of substance use disorders. And when we look at this gender disempowerment, we see that it really interacts with other adversities to increase the prevalence of common mental disorders, particularly in women. So meaning that gender empowerment will also have a positive effect on mental health. When we look at the economic domain of those social determinants, for instance, we can look at poverty, how that relates to mental health. So we see that bad economic status is associated with adverse mental health. And poverty negatively affects the neurodevelopmental and mental health of children and increases the risk of mental illness in adulthood. But by comparison, we see that employment and sufficient income is an important protective factor against mental disorders, and it's associated with better mental health and less severe symptoms and higher quality of life in general. When we look at the neighborhood domain, for instance, we can look at sustainable cities and communities, and what we find that the increasing urbanization and poverty that occurs in these urban settings, living in slums and exposure to violence that's often related to that, and drug abuse, are major risks for mental health. And we can see that well-planned urbanization can improve access to workplaces, economic situation, and better education, which then again is linked to better mental health. When we look at environmental effects, we look at climate action, we don't necessarily immediately think of mental health, but actually what we see is that natural disasters and other negative environmental events have an adverse impact on mental health, displacement, crisis, and strengthening social institutions that reduce violence and promote peace and better economic settings and social settings can prevent mental disorders and promote mental health and well-being. And lastly, when we look at the fifth domain, that's the social and cultural domain, there's quality education. So quality education is vital to develop cognitive reserve and is a protective factor from childhood on against common mental disorders and dementia. And lower levels of education have been found, and also literacy, to be linked to the higher development of dementia, depression, and suicide. So now I'm handing over to Graham Thornicroft.
Okay, thanks, Nicole. So I'm taking over the hot seat, and we just heard from Nicole a little bit about this recent publication, which is called the Lancet Commission on Global Mental Health and Sustainable Development. If you haven't come across it, I would suggest you might want to have a look, because it's really right up to date statement about where we are in the whole field of global mental health. What have we achieved, and also what are the challenges ahead? And I want to turn to a particular challenge that I think is one of the most hopeful signs about where we are winning in global mental health, namely the battle, the fight against stigma. So one of the things I do here, and greetings from sunny South London, it's now quite a nice sunset here at King's College London after a miserable week of storms and rain in the last few days. One of the things that we do is we coordinate a national collaboration of people trying to understand just how to reduce stigma and how to reduce discrimination. You can see here some of the countries involved, about 40 countries now. We're still trying to raise funds to accelerate this work at the moment. And what we've done first of all is to map out just how common and how severe stigma and discrimination are. And in two large studies, one, people with a diagnosis of schizophrenia, the other, a study of people with a diagnosis of major depressive disorder, we found that 80% or more do have experiences of social exclusion, often severe, for example, losing friends, losing family members, losing their job, and that this is common in all the countries of the world where we've undertaken this research. What do we want to do? We want to take this ugly phenomenon of stigma, which I see as a type of polluting contaminant in every aspect of the mental health field, and then apply the heat of our passion, the heat of our commitment, and also the light of evidence to achieve what? To see stigma gradually melting away. And this is from a recent stigma conference that was held in Denmark. So how do we do that? What is the key? What are we learning about how to get rid of stigma? Well, after hundreds of studies and years of research and so on, the answer is ridiculously clear and ridiculously simple. It's talking, or more specifically, it's having types of social contact. And what do I mean when I say social contact? I mean that it's arranging for opportunities for people who have experienced mental ill health to have contact with people who do not. It could be one-to-one meetings, it could be in groups, teaching sessions. And interestingly, until the last couple of years, we thought that you had to have direct in-person, face-to-face contact for this anti-stigma element to work. But in fact, probably we were wrong, because recent evidence has looked at having virtual or social media contact and finds to our surprise that this is as effective to reduce stigma as having direct in-person contact. So this means you can open up all sorts of forms and channels of social media to enabling such contact to take place. And this allows a huge potential for scaling up anti-stigma interventions. Now, the interesting element here is that it's the people who have experience of mental ill health who are the central, indeed the only active ingredient to reduce stigma. Not a tokenistic, not a marginalistic contribution, but the central active ingredient, the primary proponents of anti-stigma work. So just to begin the conclusion of our presentation today about the Sustainable Development Goals, and to turn to the question that we looked at just briefly a little bit earlier on about, do I feel hopeful? And if I do, why? The answer is yes. So I see many, many signs now of a real momentum building up. At last, a real momentum building to actively promote movement, action, to change global mental health and to make real impact and progress. For example, we see a real commitment coming forward from the United Nations with the Sustainable Development Goals. For example, a real interest now with the World Health Organization operating in virtually every country around the world. For example, the World Bank taking the question of funding mental health seriously. Organizations like UNICEF, many NGOs, global consumer groups such as the Movement for Global Mental Health. Last couple of weeks in Davos, over 10 specific sessions with the Prime Minister of New Zealand, meeting with Prince William, specifically on a mental health session, oversubscribed, hugely popular issue. Recently, I went to a large bank in London, here in the city, and on the topic of mental health, the Chief Executive Officer didn't speak in general, he spoke about his own personal experience of having had mental health problems during the crash in 2008, and his recovery and his commitment to promoting mental health throughout his organization. Just the other day, we heard that the Wellcome Trust in this country has committed £200 million to research in the area of children and young people's mental health. Just to take an example from today, I work part-time as a psychiatrist and I treat people in the first episode of psychosis. And the young woman who I saw today, I asked her what she wanted from our service. And she said she doesn't want medication, she does want to get a job back, and she's decided after a year of talking about this to start psychological treatment, but she wants to have control of the whole process. So it seems to me that the most important element now, apart from these high-level structures, is the promoting of active advocacy, active participation, active engagement by service users, by consumers around the world, in partnership with all the other agencies necessary to drive forward and to build extra momentum in the field of mental health, in the field of global mental health. So if you'd like any more information, you have, I hope, on the screens in front of you, the email for Nicole and for me. And you're very welcome to write in if you'd like further information about stigma, if you're interested in funding us to take this even further, if you'd like more information about the Sustainable Development Goals as well, if you'd like to correspond or keep in touch, you're very welcome. So on that note, thank you very much for your attention, and I'm delighted to pass back to you, Catherine. Thank you.
Oh, wonderful, Graham. That left me feeling full of hope just when you bring it all together and all of the work that's been done. And just in the past year, so many changes. And so, you know, it's just been really so inspiring. So thank you for helping share that message with the greater audience.
Really, I mean, I've actually never felt so much interest, so much investment, so much enthusiasm in the field of mental health in my working lifetime. I think this is a remarkable time, a really positive time. Yeah, that's fantastic. Thank you for joining us today, and thanks to Nicole so much as well.
Thank you, Catherine. Bye.
Bye, everybody. Cheerio.
All right, take care. Thank you.
Bye.
Bye.